All right, guys. So in this video, we're going to be going over your neck or cervical rehab. The first part of this is going to be me telling you to go and do the upper back or thoracic rehab video that I have titled Fix Your Upper Back Pain with these thoracic mobility. So you're going to do that video first, and then you're going to do these. I have 5 additional movements that you're going to do, okay? 2 of them are strengthening, 3 of them are a release of the muscle and joints, okay? So we're going to start with the 2 exercises first. First one, you're going to be laying flat on your back. Here, I'm going to put a towel underneath my neck, and all I'm going to do is I'm just going to tuck my chin straight back, pushing against the ground. I'm using the ground for resistance, and I'm going to hold for 3 to 5 seconds. And I'm going to repeat that 10 times. So push, 1, 2, 3, relax. Push, pull the chin back, 1, 2, 3, relax. We're going to do that 10 times. And then you're going to turn over onto your stomach. And now we're going to be lifting the head up by pulling the chin back in the exact same movement, but now there's no resistance. We're just going to use gravity, the weight of your head and gravity. So your chin will be resting on the floor. You can use a towel again to rest your forehead on if you want, just for comfort. We're going to pull the chin straight back. 1, 2, 3, relax. Pull the chin back. 1, 2, 3, relax. Pull the chin back. 1, 2, 3, relax. So we'll do that again 10 times in that direction. Okay, now we're going to move on to a release of the muscles along the back of the head. So right at the base of the skull, we're going to use this lacrosse ball. You can use a T-ball or a baseball. Anything like that, usually like a tennis ball or a racket ball, they're going to be too soft and too squishy, so you want something that's pretty firm about like a T-ball. So we're going to roll that ball across the back of those muscles. So what it's going to look like is you're just going to lay your head down on that ball, and you're just going to really slowly turn your head side to side, letting that ball massage those muscles and work those trigger points. So nothing more than that, nice and slow on this one. So that's what it looks like. You can do that, it's really to feel. When you feel that it's starting to be effective and it's enough for you, set maybe somewhere between 3 to 5 rotations of the head side to side. Again, it's just the area where the muscle starts to join into the base of the skull and just slightly below that too. So that's what we're going to do there for a release of your suboccipital muscles. Now we're going to move on to a massage of a muscle. I'm going to see if I can highlight this muscle for you. It's called your SCM. So it's a muscle involved in bringing the head forward and down, or turning the head, I should say, turning the head and bringing it forward. And so you can see this muscle right here that's highlighted. This is the one we're going to massage. And it comes from right behind the ear on the bone there, all the way down to the collarbone and the sternum and the ribs. What we're going to do to massage that one, and this one's really nice to have someone else do this for you so that you can be relaxed while you're doing it. But in place of not having anybody, I'm going to show you how to do it yourself. Massage oil, coconut oil is a really good thing to put on your skin just to allow your finger to glide more comfortably across your skin. You're just going to start with pressure right where the muscle starts or comes off the bone. You're going to slowly just ride your finger down that muscle. What I like to do is I like to add a little bit of rotation or turning my head towards that side to lengthen that muscle as I put pressure. And I'm just going to do the whole distance from the very top behind the ear all the way down to the bottom. You might not be able to do it all in one time. You might have to break it up into sections, do a little bit here and then do a little bit here. But it's going to look just like that. So again, I'm going to start with my head turned away. I'm going to put pressure, and I'm going to let my finger slide down that muscle as I turn my head towards that side. You can use any finger you want. You can actually kind of use like a pinching technique if you want, as you drag that muscle in between your fingers as you turn. You can use more of a broad, numerous fingers, or just the thumb like I showed you originally. You're going to do that on both sides. Sometimes you'll notice one side being a little bit tighter than the other, but when you do that, that's going to release a lot of tension that pulls your head forward. The last thing we're going to do is what's called a cervical traction, or basically a stretching of the neck and the joints and all the soft tissue in that area. This should feel really comfortable. What we're going to do is we're going to take a towel. We're going to fold it a couple times lengthwise until we get a nice long towel that we can fold in half. We're going to tie the end off. I'm not a Boy Scout, so I'm not going to show you how to tie a knot. You can use whatever knot you know works best. We're going to tie that off really tight, so we form a nice little loop here with the towel that the back of our head will rest in. Okay, and then we're going to tie the other end off to something secure. You could tie it off to the hinge on a door, just anywhere you can find around the house that you know is going to be able to provide you some resistance. Okay, so we're going to take this, and this will actually, the back of our head will sit nicely into this. So what it's going to look like here is we're going to lay down. Our head will rest in that little loop created by the towel, and then all we're going to do is we're going to slide our body towards our feet so that we start to get some tension in this rope. Hopefully I don't get out of the view of the camera and didn't make my rope too long. So I'm just going to slide further and further away. You can see the rope starts to tighten here. I'm just going to go a little bit further so I start to feel a stretch or a pull in my neck. I'm going to readjust the towel so it fits nicely behind the back of the head. I'm going to slide a little bit further away. And then that's all I do. I let that tension, or that tension in the rope, slightly stretch my head. I'm looking for maybe about 15 to 20 pounds of pressure that's pulling the spine long. If I want a little bit more, I just slide my body further away from where the rope is anchored. My head lifts off the ground a little bit, just slightly, maybe half an inch, the further I slide away. So there's a little bit of space here. I can barely get my finger right underneath my head because of the tension in this cord. And what I'm going to do is I'm going to lay here for anywhere, starting off 5 minutes. Do that for a couple days. Work your way up to doing 20 minutes. 20 minutes is the ideal treatment time. It takes 18 minutes for the ligaments, muscles, the ligaments and the muscles and the other soft tissue, the fascia, to completely relax and let go, so that way you get a real release of that pinch or pressure or tension in your neck. So you really want to work your way up to doing that at least 20 minutes. And that should take you, about a week of doing this, and you can work your way up to doing that safely. All right, guys. Have fun.